What causes chronic bloating and distension in CFS? Imagine feeling full and uncomfortable in your belly even after eating just a small meal. If you have chronic fatigue syndrome or myalgic encephalomyelitis, you might notice persistent bloating and distension that can be frustrating. These symptoms are often linked to how your gut functions, especially in ways that overlap with other digestive issues like irritable bowel syndrome. In people with CFS or ME, the stomach and intestines don't always move food along as they should. This is called gastric dysmotility. Sometimes the stomach empties food into the intestines more slowly than normal, a condition known as gastroparesis. When this happens, food stays in the stomach longer, making you feel full, bloated, or even nauseous after small meals. Studies using ultrasound have shown that many with CFS or ME have larger stomachs when fasting and impaired ability for the stomach to relax and stretch after eating. This impaired relaxation means the stomach can't comfortably accommodate food, leading to that uncomfortable feeling of fullness. Another factor is visceral hypersensitivity. This means your gut becomes more sensitive to normal sensations like gas or stretching. Even small amounts of gas or minor stomach distension can cause discomfort or pain, making bloating feel worse than it actually is. Gut bacteria also play a role. When the balance of microbes in your intestines is off, a condition called dysbiosis, it can lead to increased gas production. Certain bacteria produce gases like hydrogen sulfide, which can cause more bloating and discomfort. This imbalance can also affect the gut barrier, making it more permeable and possibly contributing to low-grade inflammation, which may worsen symptoms. Many people with CFS or ME also experience symptoms similar to irritable bowel syndrome, such as alternating constipation and diarrhea, abdominal pain, and bloating. This overlap suggests that the underlying mechanisms involve the gut-brain axis, which is how your nervous system and gut communicate. Changes in this communication can disrupt normal gut motility and sensitivity. The nervous and immune systems are also involved. In CFS or ME, there are complex changes in how nerves and immune cells function, which can influence gut motility and how sensitive your gut feels to gas and distension. The enteric nervous system, often called the gut's own nervous system, shows altered signaling in these conditions, further affecting digestion and discomfort. Understanding these mechanisms helps in managing symptoms. Pacing activities to avoid overexertion, making dietary adjustments to reduce gas-producing foods, and working with healthcare professionals to improve gut health can all help. It's important to remember that each person is different, and what works for one might not work for another. The exact cause of bloating and distension in CFS or ME isn't fully understood yet, and ongoing research continues to explore these complex interactions. In summary, chronic bloating and distension in CFS or ME are caused by a mix of delayed stomach emptying, impaired stomach relaxation, increased gut sensitivity, microbial imbalances, and neuroimmune factors. These all contribute to disrupted digestion and discomfort. Always consult with healthcare providers for personalized advice, as managing these symptoms is a key part of living well with CFS or ME.